Okay, so tonight I will be demonstrating the streaking of urine suspected of a UTI, specifically infected with the E. coli bacterium. When culturing E. coli in a urine culture, we use a 2-part culture plate that contains factor media and McConkey media. The factor media being this red side, and then the McConkey media being this clear side. The factor media is designed to grow gram-positive bacteria, and the McConkey media is designed for gram-negative. So since E. coli is categorized as a gram-negative bacterium, in theory, we should be getting lots of colonies, small round pink colonies, growing on the McConkey media by the end of the incubation period. So to get started, we have isolated the patient's urine in a boric acid preservative. It prevents bacterial overgrowth. We don't want that to happen because if there's too much bacteria growing, it looks like a big old mess and we can't really tell. So we're gonna invert the urine, and we've got a sterile biplate, and we will take a sterile loop. Gotta open up my sample. Pardon me. Careful not to touch the loop on anything. Okay, so we dip our loop into the suspension, and we will streak the factor side and in a zigzag design, and be careful not to oversaturate the medium, because then we have too much bacterial growth. Then we're going to discard our loop and grab one more sterile loop, and on the McConkey side we'll dip this one time, and we're going to isolate 3 separate areas on this side in a zigzag motion. And again, careful not to oversaturate the area. And the reason why we only do 1 dip and 3 separate areas is we're trying to dilute the solution to try to increase individual colony growth so that it's easier to see. So then we will apply the lid back on, and we're going to incubate this sample at 37 degrees Celsius for a 24-hour period. When we place our sample in the incubator, it's going to look like it's upside down, because if we put it with this side up, this lid will start to grow condensation and increase our risk of contamination. So it's going to look like it's upside down, but that's how it's supposed to be. So we will see what our growth looks like after our 24-hour incubation. Okay, so here we are a little over 24 hours later, and we've got some growth. We've got patient X's urine culture here, and we have lots of little colonies growing. As you can see, we've got these pinkish reddish colonies. These are our little E. coli friends. Well, maybe not friends. I'm sure this patient's miserable. Probably has painful urination, some blood in the urine, urinary frequency with very little void, all those fun things. So we are going to treat this patient with some antibiotics and hopefully give them some relief. But thank you for watching. I hope you guys learned something.